Board of Directors. Today's meeting is officially called to order. Please note for the record that Dr. Michelle Morse is representing Dr. Ashwin Basan in a voting capacity. So next on the agenda is the adoption of the minutes for the board meeting held June 30th, 2022. Are there any questions, comments, or changes? Can I hear a motion to accept the minutes?
Motion to accept.
So let me go through the vote quickly. Dr. Katz? Dr. Calamia?
Yes.
Yes.
Dr. McNeil? Dr. Morse?
Yes.
Dr. McCrae?
Yes.
Gary Jenkins? The Deputy Mayor Ann Williams Isom? Robert Nolan?
Yes.
Barbara Lowe?
Yes.
Anioski Peña Mora?
Yes.
And Sally Hernandez Piñero.
Yes.
Okay, so the minutes have been approved. So during the executive session, the board received and approved oral and written governing body submissions from NYC H&H Metropolitan. The board received and approved the 2021 Performance Improvement Plan and Evaluation, written submission from Segundo Ruiz Belvis Diagnosis and Treatment Center, Gotham and Rehab Center. The board also received and approved semi-annual governing body reports. These are written submissions from NYC Health and Hospitals, Kings County, and the Susan Smith McKinney Nursing and Rehab Center. So let me move on to the resolutions that we're going to look at today. So Dr. Peña Mora.
Thank you, Mr. Chair. I appreciate it. I'm looking at item number 2, authorizing the New York City Health and Hospital Corporation them to sign a lease extension with Martha Vincent, the landlord, for the continued use of approximately 2,078 square feet of space and 769 at 769 Oterdonk Avenue, Borough of Queens, to operate a primary care program managed by New York City Health and Hospital Gotham Health at a base rate rent of $69,000 per year or $33.21 per square foot, to be escalated by 3% per year for a total of $366,330.37 over the 5-year initial term, plus a charge for the system proportionate share of real estate taxes increases over a 2012-2013 base year, provided the system will hold an option to renew the lease for an additional 5 years, resulting in base rent over the potential 10-year term of $791,007.67 at an estimated $50,469.73 for the tax escalation charges for an estimated total rent over the 10-year term of $841,477.40. This was presented to the Capital Committee on July 11, 2022, and it was approved for a submission to the full board.
All right. Well, this is Ted, and I will dive in. Thank you, Fenny, for reading the resolution for us. So today I want to tell you about one of our Gotham Health clinics that we call Gotham Health Ridgewood. What you can see here is on the right-hand side, these are actually pictures of the clinic. On the top, this is some of the branding we use with our bright colors to be inviting for everybody to come and receive their care there. And that's actually standardized across all of our Gotham sites today. And then we actually are working with our security team to see if there's an alternative to the bars on the windows there to ensure that everybody can feel comfortable and safe while they're at our site, including our staff. The Gotham Health Ridgewood site's been in existence since 1994, and it's proudly served 6,587 patient visits this past year. Again, it's part of Gotham Health, and it sits on about a 2,000 square foot ground floor space on Onderdonk. Next slide, please. You can see inside of here is the clinic. I've been there myself. It's one of the staples of the community there. And here's one of the exam rooms where our patient will typically come in and wait for their care. And then the front desk, which again, we try to include bright colors to make sure everybody feels comfortable and invited when they come in for their primary care there. Next slide, please.
Bueno,
Hi, everyone. I'll just cover quickly the real estate terms for this 2,078 square foot ground floor space. The new rent will be $33.21 per square foot. We will execute on a lease renewal on October 1st, 2022. It will be a 5-year lease, and we'll have an option to renew for another 5 years. Annually, we expect an increase of 3% per year, plus our share of real estate tax increases. Over the 5-year term, we expect to outlay about $389,703. And if we take our option to renew, it would be an additional $441,773. We believe the rent is in the fair market value range, and utilities are not included in the rent. The next slide, please. And that's just a summary of the math behind what I just mentioned. Next.
So if we go to the next slide here, this actually is the request that we'd shared earlier. I'd be happy if the board would like me to read it again, or happy to jump to any questions or anything we can clarify.
Thank you, Dr. Long. Any questions from board members? Okay, so hearing none, then let me ask for a vote. Give me 1 second here.
Thank you.
Dr. Katz,
Yes.
Dr. Calamia,
Yes.
Dr. Morse,
Yes.
Dr. McCrae, Harry Jenkins, Robert Nolan,
Yes.
Barbara Lowe,
Yes.
Peñoski Piñamora,
Yes.
Sally Hernandez Piñero,
Yes.
and Jose Pagan, yes. So let's move thank you so much, Dr. Long.
Thank you.
So, Dr. Peñamora, you go next.
Thank you, Mr. Chair. I'm going item number 3, authorizing New York City Health and Hospitals Corporation, the system, to execute a contract with Genco Electrical Contractors Incorporated, the contractor, to complete an upgrade of emergency electrical service type 1 at New York City Health and Hospital, Elmhurst Hospital Center, Elmhurst, for a term to equal the duration of the proposed construction project for an amount including a 20% contingency of $1,258,472, not to exceed $7,550,830. This was presented to the Capital Committee on July 11 and was approved for consideration by the full board.
Good afternoon, members of the board and Dr. This presentation, my name is Manny Saez. I'm the Senior Associate Vice President for OFD. Today I'm accompanied by Mr. Mike Milenick, who is the Chief of Director of Design and Construction at Elmhurst, and Aaron Egan, sorry, Director of Capital Design for OFD. This presentation will encompass the regulatory requirement relative to the separation of powers, which include having 3 critical branches, one being the critical, the other being life safety and equipment branches. And with that, I'd like to hand it over to Mr. Milenick.
Sure. Thank you for the opportunity. The current state of Elmhurst's existing system does not meet the National Fire Protection Association codes and must be upgraded as required by New York State Department of Health and CMS in order to comply with NFPA requirements for critical branch separation. New York City Health and Hospitals Elmhurst was cited by CMS in March of 2018 and was granted a time-limited waiver by New York State Department of Health in July of 2018, which expired July 1st, 2021. The facility has been working with the Department of Health and the Joint Commission on an extension with the Department of Health since prior to the expiration. The Type 1 EES project will take 2 years to bring the system up to code by running 3 new branches to support emergency power throughout the facility. On March 14th and 15th of 2022, a site tour was held with 8 vendors that attended. On April 13th, the proposal deadline, 3 proposals were received. On May 10th, a pre-qualification meeting with the lowest responsible bidder, Gemco, was held. The construction contract was sourced via public bid. Gemco Electrical Contractors was the lowest of 3 bidders. their MWBE plan of 31.76% subcontractor utilization plan was presented to the group. Here's the breakdown of their MWBE allocations for the contract. The contract amount is $6,292,358. GEMCO is currently one of our JOCS electrical contractors for the period of 2020 to 2022, and also a previous JOCS electrical contractor for the period of 2018 to 2020. Valuations for both contracts were rated at 84% and 93% respectively. Additionally, the ratings listed in MOCs include 2 excellent and 4 good. It is expected we'll begin this project in fall of 2022 with completion expected in fall of 2024. GEMCO does meet all of the requirements under their performance evaluation, and performance and overall quality rating from the other facilities is an overall good. For the project budget, we have the construction project as noted as $6,292,358 with a project contingency 20% additional to that at $1,258,472, bringing the total to $7,550,830. Full funding for this project has been allocated, and the CP is pending with OMB for approval. We did request a 20% contingency, which is a little higher than typical, but there is a higher potential for unforeseen field conditions due to the aging, quality, and infrastructure in the building. And any request or change to draw from contingency is evaluated through the change order process and requires approval from OMB on release. And here is the request for the board approval, which was read earlier. Happy to take any questions that anybody has.
Thank you so much for your presentation. Any questions from board members? Okay, so let me then ask for a vote on this. Dr. Katz?
Yes.
Dr. Calamia?
Yes.
Dr. Martone? Dr. Morse?
Yes.
Dr. McCrae?
Yes.
Gary Jenkins? Robert Nolan?
Yes.
Barbara Lowe? Benioski Peñamora?
Yes.
Sally Nández Piñero?
Yes.
Anita Kawatra? Okay, so, and Jose Pagan, yes, so the resolution passes. Thank you so much, Manny and the whole team.
Thank you.
Thank you.
Let me move on. Dr. Calamia, you go next.
Thank you. Resolution 4, authorizing New York City Health and Hospitals Corporation, the system, to enter into standby contracts with the following 6 firms: Rapid Reliable Testing New York LLC, also known as DOCO, MedRight Testing LLC, Centina Health Inc., Elevation Health LLC, Premier Assist, and Fulgent Genetics Inc., the vendors, to perform COVID testing when necessary as directed by the system's president, with each contract to have a 2-year term, and with the set of contracts not having a pre-established not to exceed amount. It was presented at Medical and Professional Affairs Committee on 7/11/22, where it was approved for presentation to the full.
All right, thank you, Dr. Calamia. This is Ted again. So I'll dive into the presentation here. So by way of background, the problem we're trying to solve here in terms of our scope is to be able to plan ahead for future COVID-19 emergencies with the need where we'd have a need to do surgeon of COVID testing. So while in the past we've done routine testing through DOE testing, through our community testing sites, we know from Omicron that there could be a need in the future where we need to drastically surge up our testing capacity very, very quickly. So in order to plan ahead, in order to meet that need should it arise in the future, the way we would set this up here, the contracts would have would be $0 now, and they would help to avoid the need for emergency procurement because we'd set up the commitments now in terms of the contract structure that could be activated on an as-needed basis, titrated to the level of emergency that we would be facing. So next slide, please. So under routine contracts, just a couple of words about cost. Pricing is based on a per test or per team per day basis. For this, we encouraged a similar structure, though we were more flexible in allowing some varying pricing structures to be proposed to us. In terms of ancillary costs, the vendors would be managed by existing health and hospitals, test and trace, and ambulatory care staff. There would be no additional internal resources needed. There would be a project management piece of this, which I will get to in a separate presentation because there's a separate contracting structure for that. So in terms of the RFP criteria, we set out to have a minimum criteria of 5 years in the business and public health testing, experience with rapidly deploying services like this. Our substantive criteria were 30% relevant experience, 30% thoroughness, 25% cost, 15% MWBE. Our evaluations committee was comprised of ambulatory care, emergency management, and MMPA staff. Next slide, please. So in terms of an overview of the procurement, we put the RFP in City Record in March of 2022, so a couple of months ago. In April, we had a pre-proposal conference, and we received 15 proposals on April 19th. We then had the evaluation committee meet, and on May 2nd, the evaluation committee completed scoring, and the 6 highest rated firms were selected. Next slide, please. In terms of to go into a little bit of detail about those of the 6 firms that we had prior experience with, Rapid Reliable Testing has always had satisfactory performance with us. Their MWBE performance dipped a little bit in the winter of 2021 due to expenses required to meet the Omicron surge. And again, part of the premise here is that if we plan further ahead with setting up this contracting structure ahead of time, we'll be able to better control contingencies in the future. For MedRight, they've had satisfactory performance and MWBE attainment. Premier Assist has had satisfactory performance and MWBE attainment. And Fulgent Genetics is one of the vendors that we've talked about in prior board presentations where they had underperformed on MWBE goals, but by working in concert with us, they've been able to achieve a satisfactory MWBE performance, which was a market improvement for them. So in terms of vendors without experience, Centena Health, we've worked with in terms of informal coordination, which has been satisfactory, and Elevation Health has the current community testing contract, but we've not utilized their services aside from them being a subcontractor for CIC Health, which is part of our school testing, in which their performance has been satisfactory. So to go into a little bit more detail on the MWBE utilization summary, the upshot of this is that all 6 of these vendors have the goal set at 30%, except for Elevation Health, which is an MWBE themselves. Therefore, their goal is set at 100%. Next slide, please. So in terms of the requests for today, the Office of Ambulatory Care and Population Health is seeking approval to award these 6 firms a $0 contract value contract to provide COVID testing in the case of an emergency response. 6 firms are listed here. The way the process would work is the New York City Health and Hospitals President CEO could activate the agreements working with OMB, and then we would let the board of directors, we'd notify you right away and provide expected expenditures based on the nature of the emergency that we're seeing. Just to give a ballpark of the dollar amounts that that we could reach here, if you look at the Delta surge scenario, that was about $75 million. If you look at the Omicron surge scenario, it's actually a little bit lower because while Omicron is more potentiated, it was shorter in length. That was $26 million.